Hi, I'm Dr. Mark Lorenzato. This video is about constipation, about both acute constipation or new onset and chronic constipation. Diet has a profound influence. Sugar and starch are absorbed rapidly in the small intestine. This means that if the starch is adequately cooked, as food leaves the stomach and goes into the small intestine, it is rapidly absorbed mostly into the liver circulation, where it is then turned into fat or populates glycogen stores. The important thing about this is, in general, if somebody instead has fiber in their diet or more complex carbohydrates, it does not rapidly get absorbed in the liver and then moves to the colon where it can be fermented. There's also a concern that it may be fermented in the distal small intestine from bacterial overgrowth there. Fiber is considered insoluble or soluble. Soluble fiber is essential to avoid constipation. Fiber should not be thought of truly as we think of fibers of cotton fibers and such. It is more about how food is absorbed. Constipation occurs when a diet is low in fiber or occasionally high in fiber. In this case, when they have a very high fiber diet, it may sort of back them up and create so much bulk it's problematic. In general, if a person has adequate fiber in their diet, it moves to the colon and pulls water into the colon, makes the bowel movement easier to happen. Of course, the coordination of all the nerve impulses that pull the food and push the food through the intestine are very important. So we have to have a functioning neurological system. The muscles have to be strong enough. There needs to be enough moisture, and then we should avoid constipation. You have control over the amount of water you put in and the amount of water in your system. Very common in the winter for people to get very dehydrated because they're breathing dry air from having an inside atmosphere that's heated and sometimes an outside atmosphere that's very cold with a low water content to the air. Therefore, constipation is generally a disorder of eating and of hydration. Sources of soluble fiber, the fiber that generally creates more fluid on the surface of the intestine, keeping it moist and mucoid, include beans and peas, oatmeal, barley, rye, pectin-rich foods like apple and crisp pears, prunes, plums, berries, bananas, broccoli, and carrots, foods high in inulin, which is the polymer of fructose. Those are particularly onion, garlic, jicama. Apples are high. Psyllium seed husk is particularly beneficial because the mucilage, the moisture surface molecules that it provides to the intestinal wall. Content of soluble fiber is mostly complex carbohydrate that's not absorbed in the small intestine. These include pectins, inulin, fructose polymer, beta-glucans, of which my favorite is in oatmeal. These retard the amylase from actively cleaving sugar, large starch molecules to make it into sugar. So therefore it slows the release of sugar from starch molecules, beta-glucans. Hemicellulose and lignin, wood-like structure molecules. Arabinoxylan is a type of sugar group that is very common. Dextrins and oligosaccharides. Dextrins are more extensive sugar-like molecules, and they can be rapidly absorbed depending upon their complexity. They can be less rapidly absorbed. The waxes, of course, are not rapidly absorbed unless they're emulsified well, and even then, when they're larger molecules, they are not absorbed. Resistant starch from partially cooked potatoes, bread, wheat, all those things, unless it's adequately cooked, it will just pass through your system. So transit time of food is something that influences whether something causes constipation. Food that has a very short transit time flows through our system, no constipation. So digestion is in phase. There's enzymatic activity in the mouth. As things enter into the stomach, the acidity of the stomach really cleaves things and breaks them down. As they move into the small intestine, they are emulsified. The fats are emulsified with the bile acids, and enzymes from the pancreas work to cleave proteins and fat molecules. The mechanics of the mouth of swallowing and of the churning in the stomach can be very important. Motilin is very significant in that erythromycin, a common antibiotic, and the other macrolide antibiotics can stimulate motilin, which will cause migratory myelectric complex to push food through your intestine. It's this peristalsis, or this wave-like contraction that is brought on by erythromycin. If you're having problems, we may prescribe a low dose of this. So food content and preparation is critical. How you prepare your food, how much moisture is in it, how much starch is in it, if the starch is thoroughly cooked so that it's absorbed in the small intestine or not. The effect of antihistamines can be significant. They tend to dry membranes out. Other prescription medicines, including narcotics, can also cause constipation, as well as the benzodiazepines and drugs like Zolpidem used in sleep. Some supplements may actually make things worse too. Of the genetic causes, things called channelopathies, those are generally sodium, potassium channels. Particularly sodium channels are complex molecules in the intestine that allow for flux of these key minerals and electrolytes. Some people have a genetic abnormality to them, and they will just always have problems because of this, but the calcium channel blockers may affect significantly whether the channelopathy causes a constipation or not. Beyond this, people can develop a lack of neurological stimulation to the colon, particularly the condition of aganglionic, where nerves do not form properly to the large intestine, making it larger without the ability to contract. And acquired disease processes, particularly insulin resistance and diabetes, can slow the transit time because a person can develop gastroparesis. They can develop fatty liver, so they're not digesting their fats as well and regulating their sugars efficiently. Irritable bowel syndrome has a big crossover with chronic constipation. Some people with irritable bowel will have more diarrhea, other ones will have more constipation. And to recognize that there's a problem with irritable bowel syndrome and look at the underlying causes overlaps what we do when we look for the underlying causes of chronic constipation. Physical activity or lack of physical activity can be a real problem. A person needs to be physically active in a cardiovascular way, and sometimes simple sedation will be a major contributory factor. Emotional skills may be taxed in this because it can be difficult coping with constipation, and it can take its toll on a person's sense of well-being without question. Some medications that are used can basically create both psycho-emotional problems and constipation at the same time. Stool softeners, on the other hand, are generally very safe and a good solution most of the time. They're not always sufficient of a solution, but they definitely facilitate normal bowel movements. Dioctyl sodium sulfosuccinate, which is why I just say cholase, can take up to 72 hours to work as a stool softener. It is an emulsifying agent. Avoid mineral oils when you use it. Bulking agents, which are non-soluble fiber, including good beans and broccoli and things like this, can be very valuable. Soluble fiber, oatmeals, as I mentioned, was one of my favorites here. And osmotic laxatives can all be used. Osmotic laxatives include lactulose, which is not absorbed in the intestine and therefore pulls water into the intestine, as well as sorbitol or polyethylene glycol. All work in this way. Stimulants are not considered particularly advantageous because they create problems, but caffeine is one that is noted and frequently used. Cascara, senna, phenolphthalein, castor oil, all these can be stimulants. Specific chloride channel activation in individuals, particularly women with irritable bowel syndrome of the constipation type, has been shown to be effective in that limited group. Lubiprostone or Amitiza is the medicine used here. And as I mentioned, erythromycin in low dose stimulates lometin. So an overview, increasing soluble fiber is the most fundamental thing. Enhancing cardiovascular exercise, bringing it into part of your lifestyle as a regular basis is very valuable. Not getting dehydrated in the process, because that can easily happen as you're breathing rapidly if the air is dry. dealing with the underlying psychoemotional problems of eating disorders, if there is one, and looking at whether constipation is something you do as an attempt not to have a bowel movement in public or something. These problems can be generated at a very young age by parents when they're attempting to guide their children, but miss the point sometimes. Genetic variation is clearly a factor in chronic constipation. In shortest term constipation, I have not mentioned that mag citrate or magnesium citrate can be used in acute constipation as a valuable means to eliminate the bowel contents. It is a salt. It is kept in the refrigerator, so it's tolerated to drink it. You either drink half a bottle or full bottle and usually have a bowel movement within 30 or 40 minutes. The caveats: if you're not hydrated well, then fluid cannot move into your intestine, which is how this is supposed to work. Walking, being up and vertical can always help. People that spend a lot of time in bed have much greater tendency of getting constipated. So each individual needs their best solution, and I can work with you to get that. We have a large combination of things we can do. We need to understand if this is an acute problem or a chronic problem. I mostly address chronic problems here, but they may be overlapping. In conclusion, constipation can be something almost trivial, from dehydration, perhaps resulting from overexuberant physical activity or a fever from a virus. It can be the result of more insidious and serious underlying disease that needs to be investigated. The management for a chronic constipation is frequently just dietary change, which is quite effective. We've explored the medications, stool softeners, and other medications that are effective in managing constipation, as well as some food changes that you may benefit from. I suggest you follow up with any test that I've recommended here because of the vast assortment of disease processes that can contribute to this.